So I'm doing Cerebral Palsy by Bobby Bridges, me. So what is palsy? Cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. Cerebral comes from the word, so cerebral means having to do with the brain, and palsy means weakness in or problems with using the muscles. So this can affect things like movement, like the person's moving with their hands, arms, feeding and eating, learning. People can have different learning disabilities from this. Seizures, communication could be a hard thing just because some people with cerebral palsy can't talk as well. Symptoms of cerebral palsy. The symptoms vary from person to person. A person with severe cases might need to use special equipment to be able to walk or might not even be able to walk at all and need lifelong care. Like, so some of these people that can't walk are in wheelchairs. So there's people with obviously like the normal wheelchairs where they can use their arms, and then there's more extreme cases like where it's like a fully automatic thing where they can move a little bit, but they still need a fully automatic thing to move around. The person with a mild case might be able to walk awkwardly, but not need any other special help. And it doesn't get worse over time, but the symptoms can change in a person's life. So like people can go from they can go from being able to walk, and then like when they'll get older, so then it can affect things like they might not be able to walk anymore, so need more assistance with like wheelchairs and things like that. So what causes cerebral palsy? Cerebral palsy is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control their muscles. There's what are the different types of cerebral palsy? There's four main types of cerebral palsy. Spastic cerebral palsy. This is the most common and it affects about 80% of the people with cerebral palsy. This increases the muscle tone, which means their muscles are stiff and their movements are more awkward. The second is dyskinetic cerebral palsy. And this, if someone has dyskinetic cerebral palsy, they have problems controlling movement of their hands, arms, feet, and legs, and which this can make it obviously difficult to sit, walk, do things like that. So, and the third is atasic cerebral palsy. Someone with this will have problems with balance and coordination. They might walk unsteadily. They might also have a time with quick, they might have a hard time with quick movements or movements that need a lot of control. So different, like harder movements like that. And then mixed cerebral palsy, which is just people have symptoms of more than one. So they can have a combination of both, or not both, but they can have a combination of some of these. So a diagnosis of cerebral palsy. Symptoms of cerebral palsy can become more apparent over time. A diagnosis might not be made until a few months to a year after birth. And if the symptoms are mild, it could take even longer to find out if they have cerebral palsy. If suspected, the healthcare professional will review the child's medical history, do a physical exam, and then monitor the child's growth over time to see if it's getting worse or what's happening to the child. Brain scans can reveal areas of damage or irregular brain development, and these can be used in MRIs and cranial ultrasounds just to see what's wrong with the brain, where where the different parts are, and where it will affect. Is there a cure? No, there is no cure, but treatments can help improve function. However, a wide variety of treatments and therapies are available to manage symptoms, improve quality of life, and help individuals be as active and individual as possible. Just so, and as individual, I mean, they don't need as much assistance. Common treatments for cerebral palsy are therapies like physical therapy, occupational therapy, and speech therapy. These obviously help improve the quality of their lives. Medications can help. There's different ones. Botox can help with the structures and the muscles. There's muscle relaxers and things like that. Pain relaxers, obviously. Surgeries can help and assistive devices like braces, wheelchairs, and communication aids will help, obviously, the people. So my case study, this is the patient's details. The name is Allison. She's a 25-year-old female. She has spastic cerebral palsy. The medication is baclofen, and her activity level, she goes on short walks but tires very easily, which is very common in people with cerebral palsy because they're not as able to be as active as the people as like people without it, so they'll tire easily because they don't have the cardiovascular endurance. She has a moderate risk of neuromuscular condition and she has signs of low cardiovascular health. It would be recommended to get her physician's clearance before starting exercise because obviously she has cerebral palsy, and patients with cerebral palsy may have underdeveloped motor controls and bad cardio capacity. Obviously, like I said, this is because they're not able to walk. Some of them aren't able to walk or function like people without it. So her goals are to improve walking endurance and aerobic capacity, increase strength in her lower body and help reduce fall risk, improve flexibility, and enhance balance and coordination. So for her exercise testing, for her aerobic capacity, she's going to do the 6-minute walk test. This is where she walks 6 minutes. She might need assisted walking. Strength, it's the handheld dynamometer to test her grip strength and overall strength. Flexibility, she's going to do the sit and reach test. It's modified, but she is able to do that. And then the balance is the timed up and go test. For her exercise prescription, for her aerobic, her frequency is 3 to 5 times a week. Intensity is 40 to 60% of her HRR. And then the time is about 20 to 40 minutes a day. And then the type could be anything like walking on a treadmill, but make sure she has the supports just in case she loses her balance or needs them. Stationary bike, obviously, would be more practical than a real bike just because it's way safer. And then things like water therapy can help people with cerebral palsy just because it takes like her body weight off of out of the picture, so she's able to walk around easily in the water. For strength, she should do it 2 to 3 times a week, but make sure they're on non-consecutive days. She should do around 50 to 70% of her one rep max, which is about moderate intensity. And then she should do 2 sets of 10 to 15 reps for each muscle group. And when she's doing this, she should make sure to increase the reps before she goes up in the intensity just to prevent any type of injury or anything going wrong. Some types of exercise she can do is a seated leg press, hamstring curls, or knee extensions. They should both be seated just to make sure she's all right. She can do rotational resistance bands. Um, Again, should be done seated. Most all of her exercises should be done seated or laying overhead tricep press extensions and then seated rows. For flexibility, she should do this daily just to improve that as much as she can. She should go to mild discomfort but never to pain, just as any flexibility thing should be. She should hold each stretch for about 30 seconds for 2 to 3 times per muscle or that she's stretching. And then static stretches for hamstrings, hip flexors, hip abductors and adductors, and lower back should all be done. And then for balance, she should do this 2 to 3 times a week. Moderate intensity, not pushing herself too hard. And she should do this for around 15 to 20 minutes for the 2 to 3 times a week. And things like standing on the AirX foam pad, single leg stands at the bar, and cone step overs, these should all be done with some type of assistance. If it's not a person, it should be done holding on to something or just making sure she's as safe as possible. So her precautions and modifications, she should avoid fast moving movements and focus on slow controlled reps. She should allow for longer rest time to control fatigue, obviously because her anaerobic or her Yeah, her anaerobic capacity isn't as normal as it should be. She should use equipment with support if needed. Like I said, holding onto a bar, holding onto a counter, something like that. The medication she takes, baclofen, might cause muscle weakness or fatigue. So if she's feeling extra fatigued, she should adjust that. And like I said, for the strength training, and when she's increasing she should increase the reps or how long she's doing something before the intensity, just to make sure she's as safe as possible. And then avoid areas that might have fall risk or things in the way. So if she's doing anything really, she should just make sure that there's a safe spot to work. Conclusion. While creating exercise prescriptions for people with cerebral palsy might be challenging, it also makes you think outside the box and create specialized programs to fit the needs of the individual. Exercise might be hard for those with cerebral palsy, but it is definitely possible. And just like everybody else in the world, exercise is not only recommended but encouraged. And I just wanted to talk about this. So I work at a PT place as an aide, and there's this guy that comes in. He's an older guy, and he has cerebral palsy, and he's in a fully assisted wheelchair, and he has like a person, like an aide walking him around always. And it's awesome to see like how he works out. They have a whole modified program for him. He comes in, they stretch him out, and then he does like everything. It's awesome to just see how they modify it, the PTs modify it to fit his individual needs and to make sure like he can have a happy life.